Dr. Lowry here again, and hope you're having a good day. As promised, we're going to talk about blood pressure taking, blood pressure monitoring at home. And why should you take your blood pressure? Well, studies have shown that higher blood pressures can lead to strokes and heart attacks, so it's good to keep it to a number basically under 140 over 90. 140, the top number being the systolic, and the bottom number is the diastolic. The diastolic is the pressure in the pipes all the time. So you want that to be particularly low, preferably in the 70s and 80s. And the top number is high. Now, blood pressure tends to creep up with age, and people sometimes in their 60s, 70s require a gentle blood pressure medication. Now, your doctor will want to know if your blood pressure is too high, especially after you started a blood pressure medication, or if your blood pressure is too low, if you find you're dizzy at home or you get dizzy when you stand up, suggesting orthostatic hypotension. So blood pressures under 90 can be alarming, especially in the setting of dizziness. But if you're a cardiac patient, sometimes a doctor or cardiologist will like you to run in the low area in the 90s, just so your heart doesn't work as hard. So that's the long and the short of it. So we're going to get started with the blood pressure, and I have a digital cuff which I've recommended, actually not this one, but any digital cuff that you can find in the pharmacy. You can ask the pharmacist which would be the best brand, and you see I've got an arm cuff here. I think you'll notice, and I've got the arrow lined up with the artery. Now, if you want to check your pulse, you can check your pulsing artery next to your thumb, and count the number of beats in 15 seconds and then multiply that by 4 to get a crude estimate of your heart rate. But most of these blood pressure cuffs actually do measure your heart rate, so you're good there. So again, have the cuff fairly snug up from your elbow. You don't want it resting on your elbow. And then I usually take blood pressure readings, at least 3 blood pressure readings. I discard the first blood pressure reading. I'm taking that right now, and I'll show you. And then I usually record the second or the third. Now, I suggest you take a log of your blood pressure either in the morning or in the afternoon. You can take it every day, twice a week, but your doctor will want to see that, at least a picture of the record if you can't make it in, or at least call your numbers in to your advice nurse or your doctor if he's taking the calls. Anyway, I checked my blood pressure earlier and it was 117 over 70. And now it's increased to 126 over 83, probably because I'm excited to be talking to you. Anyway, I discard this blood pressure and then take the second too, because I feel the first blood pressure, the system is just inflating and getting used to you. The second and third tend to be lower, and that's the one I would record. I think that's all I wanted to say about the blood pressure cuff. Some of these have a memory and they'll save them for you. You can take a picture, like I said, and forward it to your doctor or your primary care person. But I think that's it. Anyway, thanks for listening, and we'll have more devices to go.